might be अभी आपको मेरी आवाज़ clearly आएगी, right? So what I'm discussing here is कि normal ovaries में, in the normal condition of ovaries, from the primordial follicle, in the process all the follicles are maturing, and after that the ovulation processes happen there, right? But in PCOD condition, there are so many immature follicles are developed there, and that immature follicles filled with the fluid and take the form of a cyst in the ovary, right? So before proceeding, let's see what the hormone androgen, which is basically a male hormone playing a role in female body, right? So this androgen hormone is very, very important and essential for woman body also, because it helps to kick-start the puberty in female body. It helps to stimulate the hair growth of pubic and underarms or axilla in the female body, which is a sign of puberty. It regulates so many organs normal function, like kidney, liver, muscles, reproductive tract, even in bones. So you can say in adult woman it's necessary for estrogen synthesis also. The androgen hormone is important there, right? It's showing it plays a key role in the prevention of bones as well as the sexual desire and satisfaction in female body. So dear friends, what you think? The PCOD and the PCOS, the two very similar sound terms, is both these things are similar in the similar. So dear friend, I'm going to tell you the difference between both these things here. As we can understand here that the PCOD stands for the polycystic ovarian disease, whereas PCOS stands with the polycystic ovarian syndrome here, right? Clinically, you can also diagnose with both these conditions when patient comes with the USG report with you, right? So you can understood that in PCOD condition, the less number of cysts are there, like 2 or 3 cysts are only there. But in condition of PCOS, there is more than 10 cysts are there in the ovary, right? So as in the PCOS condition, more than 10 cysts are there, right? It can lead to the infertility. But generally, the PCOD condition doesn't lead with the infertility. The female, those who are suffering with the PCOD, can conceive easily with the condition of PCOD. Right? The PCOS condition is less common than the PCOD condition, right? So it's easy to revert the PCOD condition in comparison to the PCOS. Right? The very major and important difference between the PCOD and the PCOS, that is the hormonal problem. When we talk about the PCOD is a hormonal problem, and the PCOS is a metabolic syndrome. It considered as an endocrine problem, right? So PCOD contains immature eggs in the female body, right? Whereas the production of androgen increases in PCOS can lead to the anovulation, because the hormone, the male hormone is increases in the female body, can lead to an anovulation. It means the ovulation is not there, and when the ovulation process is not there, the chances of infertility is increasing a lot there. That's why PCOS can develop the infertility, right? If we are talking about the clinical symptoms of both this condition, PCOD stands with the irregular menses, with abdominal weight gain, with the facial hair growth, whereas the PCOS condition lead with infertility, obesity is there, hair loss is there, and hirsutism is also there, right? That's why we can say that the treatment of PCOS is quite difficult in comparison to PCOD, because the hirsutism symptom is also there, and with the hirsutism, when female is consulting you, it's always taking a long time and little bit difficult also to treat. Okay. If you are talking about the another contributing factors which are contributing for developing a PCOD or a PCOS condition in a female body, the first one is the excess amount of insulin in the body, right? Second, as we already discussed, the high amount of androgen in the body. Another one is the genetic factor. When the mother or a grandmother or the close blood relation females are suffering with the same problem, the chances of getting the PCOS in the female is higher now, right? Second one is the early age menarche can also lead with the problem. Unhealthy lifestyle, the stress, which is a major factor to develop the PCOS in females nowadays. Another thing is the diabetic drugs, the use of diabetic drugs and the birth control pills for a long time can also contributing factors for developing the PCOD or PCOS condition in female body. When we are talking about these conditions, so PCOD and PCOS can lead to the heavy or a painful menses. The obesity is also can be developed. On the end stage, we can say the cancer of the uterus might develop, the depression, anxiety, mood swings, the metabolic issues like diabetes, gestational diabetes, the heart diseases, high blood pressure, the high cholesterol or stroke-like conditions. This condition may lead all these things if we are leaving them untreatable for the long time, right? When we are talking about the common symptoms on the basis of which we can clinically diagnose the patient, is the first and foremost thing is the irregular menses. Another one is the acne. Unusual and excessive acne are there. Hair fall from the scalp, excessive hair fall is there. Heavy bleeding from the uterus is there. Darkening of the skin is there. On so many places we can find the dark patches like brown spot, black spots are there on the skin. The wet gain, the sleep apnea. The sleep is very difficult with the PCOS problem especially. The facial hair growth is there, especially on the chin, on the back, on the chest, especially in the females, right? Another common symptom when we are found, as I said already, the mood swing. In the mood swings, what commonly females are suffering is they're getting the good and a bad mood so frequently. The change of mood is there, right? Other thing is headache is there. Another thing is the male pattern baldness is there. It means the baldness from the ear especially going to start, or patch from the ear is going to start. That is the male pattern baldness is there, right? So for the better understanding how we can handle the cases of PCOD, PCOS in our practice, I just want to discuss a case of a successful case of PCOD with all of you today here. So just try to understand the case, try to listen it properly, and if you at the end of the case, if you want to share your views, any remedies selection, analysis, rubric selection, anything about the case, your understanding about the case, you can share in the chat box. I'm reading from here. Right, so let's start with the case. It's a case of a PCOD of a 21-year-old female. She's a student and pursuing the CMA degree of her. She is a non-vegetarian person. First time the patient is come to me on 15th of March 21 with the USG report of her, because she already knows about her problem. So she come up with us with a USG report, and what report says I'm going to read for you here. According to the report, USG report, a small 21 mm cyst is seen in the right ovary. and multiple 5 to 6 each ovary small cysts are also seen in both the ovaries measuring 2 to 6 mm, right? And this is the USG report of a date of 15 March 2021. She consulted to me on 3rd July 2021, right? So the day she consulted to me, she come to me with the complaint of oligomenorrhea, that is irregular menses since 7 months. She's like, my menses are appear in 1.5 or 2 months. Spotting and after the menses the spotting is there for 8 to 10 days, means after the normal 4 to 5 days of bleeding, the spotting is also stays there for 8 to 10 days, right? There is a scanty or heavy bleeding. Sometimes the bleeding is heavy, sometimes it's scanty, with the too much stomach pain, right? The unbearable kind of a stomach pain is there. And another sign what she explained is the heaviness of the breast before and during the menses what she is experiencing. Another complaint is the headache since very long she have a headache, and she's like, this headache is frequent after taking the COVID vaccine, right? Headache is ameliorated by the vomiting, and after the long reading, as she's using the spect also, after the long reading the headache is increases. When I talk about more about the case to the patient, she explains about the nature of her, right? Okay, so about her nature what she explained, I'm going to read from here. She's like, I like to do the creative work, especially the paper work, the paper creative work, room decoration, the clay work. These are the her interest areas. She's like, I thought I will do craft well, but I'm not perfect in craft and dance. She loved to do the crafting, but she's like, I'm not so much perfectionist whatever I'm making in the craft. She's like, in lockdown routine was completely changed and I doesn't like that. She said, because of that change routine in the lockdown, I feel the inactivity in myself. She's like, she loved to chit chat with the friends, loved to be with the friends, and all these things are stopped because of the lockdown. So she's like, if my routine or my schedule is changed, I doesn't like that. If any interruption is there in my schedule, in my routine, in my daily routine, I doesn't like that. She's like, it affects me a lot, right? My work are delayed, which I dislike the most, right? She scheduled should be proper there. According to her, everything should be scheduled very properly, and if any change, any disruption, any interruption is there in the schedule, she doesn't like that, right? Further she explained about herself that I'm in a relationship since 6.5 years, and if I get hurt or anger on anything, I'm unable to speak up even after this 6.5 long years of relationship. Further she said, if I feel low in myself, I used to cry, and after crying I feel better. Another thing which make her feel better is the improvement in the routine. अगर रूटीन के काम प्रॉपरली होने लगते हैं तो आई फील बेटर, विच मेक हर फील टू गुड. शी ऑलवेज फील इन हर सेल्फ दैट शी फील द डेफिशिएंट स्किल वाइज. उसको ऐसा फील होता है कि मुझ में स्किल्स कम है किसी भी चीज़ों को लेकर. शी हैव फियर ऑफ कॉम्पिटिशन लाइक इंटरव्यू एंड एक्सेट्रा. शी हैव अ लॉट ऑफ फियर, हाउ कैन आई एम गोइंग टू appear for the interview, I am going to speak in front of the people, those who are asking me question in the interviews and all, because she said I have a very low level of confidence. I have no confidence to to face all this thing. That's why she have fear of competition. She's like, I'm sensitive, I'm sensible, and I used to cry very easily. She's like, my family affects me badly. Anything happen in the family, anything happen related to the family affect her very badly. She's like, it develops the negativity in me, right? She feel low of confidence and used to cry in alone. She's like, whenever I feel to cry, I need a alone space to cry only. I can't cry in front of the people. She said, my paternal uncle expired because of the COVID-19, and this is the unbearable pain for her because she was so close to her uncle. Another thing about her, she said that I have a habit of nail biting. मुझे नाखून खाने की आदत है. She's like, I wrote so many poems. She's a poet writer also. She used to write so many poems actually. And she feels like the poems are a part of their life, part of her own life actually. She's like, I'm so much anxious about my mother's health also. That make me always anxious, and I started feeling ill if my mother is not well. She's like, and I started feeling ill emotionally as well as physically if my mother is not well, right? She's like, I try to give her my positive vibes always. I try to give the positive vibes to my mothers always. I affect majorly by her health. Other thing about the patient is, during anger, the cold sweat is there. During anger, the heart beats are fast. The body shivers from the inside. अंदर से shivering होता है अगर गुस्सा होती हूँ मैं तो, right? About the family history of patient, when I read, I got that the mother have heart problem. She have hypertension also. The maternal grandmother had paralysis. The one of the maternal uncle had paralysis also, and 5 maternal aunts are there. Out of them, second number have the diabetes and 5th number is obesity. About the paternal family, so paternal grandfather had asthma, grandmother have angioplasty and she is hypertensive. Paternal uncle is also hypertensive and has some kidney problems also. And she had one paternal aunt who have asthma. If you are talking about the generalities of the patient, right? She desire for the sour things in the 4 marks. Means she desire too much about the sour things. She avoids the tomato, the cooked tomato she doesn't like. The thirst is also there, which is up to the 2 liter per day, which is a normal thirst. Thermally, the patient is hot. She said on bladder, she doesn't have a control for long time. And in past, she had a bed wetting habit also since till her 6th standard, right? Other thing, she have perspiration on her forehead and occiput, which orders too much stinky, and there is no stain of perspiration. She's like, I used to talk during sleep, which is her family problem. In family, other people are also used to talk during sleep. She's like, if you're talking about the dream, so she's like, I have rarely she had dream. There is no repeated dream, and she can't remember dreams also. So this is about the case. If any one of you like to share your views or your understanding, some remedy selection or anything about the case, I'm welcoming you here for the discussion, right? You have 2 minutes only for that, because we are already running late and I have to share my analysis about the case also, right? So you have just 2 minutes. Share your views here if you want to talk anything about the case. Just one minute. Raksha? Okay, so I like to share my analysis about the case. So let's try to understand the miasmatic understanding of the case first. So in this case, we can understand here that the psychotic miasm is predominantly present in the case. And the reason why the psychotic miasm is predominantly present, first thing, the disease itself tells us about the miasm. So here cyst is there, the overgrowth of something is there, which represent the psychotic miasm well. Second thing, the lack of self-confidence is there in the patient. Right? She can't express herself. She's unable to express even in a long relationship, after a wrong relationship, she's unable to express herself. So these are the key points where we can understood about the miasm in the case. Right. So unfortunately I am unable to share my screen here, otherwise I want to show the USG reports of before and after, where we can see in 5th Jan report that there is no significant abnormality is seen in the patient, where in the first USG report we see a small clear cyst in the right ovary and multiple small 2 to 6 mm cyst in the both the ovaries. If you want to check this reports, before and after reports, you can check on my Facebook page or my Instagram page by the name of Dr. Vibha Mevada. Right? So when we are going on the analysis of the case, the important thing we are collecting in the analysis, so what we are got in the case, important things is change in routine is aggravating the patient. Right? She have a lack of confidence. The family things matter a lot to her. If anything develop in the family, anything happen in the family affecting her very badly. Right? Another thing, anxiety aggravates her. Right? During anger, the cold sweat is there. Right? She desires for the sour things very much, and she avoids the cooked tomato very much also. The perspiration, which is very, very odorous, very profuse odorous perspiration is there. Right? On the basis of this analysis, the rubrics what I select from the repertory, I'm going to read all the rubrics from the repertory what I have selected for this particular case. So the first rubric I took here is the mind work routine desire, because she have a disruption or interruption in the routine always aggravate her. That's why the mind work routine desire is there. Mind change aversion to, right? Because she doesn't like if any change is there in the routine. The mind confidence want of self, because lack of confidence is there. So the rubric for that is the mind confidence want of self. Another rubric, the mind anxiety aggravation element from, right? Because all anxiety is aggravating the patient. Another rubric is the mind talks sleep during. She is talking during sleep. The perspiration cold, perspiration odorous. Another rubric is the generalities food and drink sour acids desire. Generalities food and drink cooked food aversion, as she averts from the cooked tomato. When we doesn't got that much particular rubric in the repertory, in general we can take like cooked food aversion, right? So when I put all these rubrics in the repertory chart, what I found here is the Kali carb is standing on the first position in the repertory chart, right? And just not because Kali carb is standing in the first position in the repertory chart, I prescribe this remedy. But whenever I go through even with the repertory for solving the case, always keep in mind that the materia medica is the final authority to select that particular medicine, right? So like that only, I used to read from some particular materia medicas about the kali carb, and I just want to read here in short from some different materia medica for the differentiating the remedy kali carb, why I prescribe that, right? So I'm reading this about the kali carb from the Soul of Remedies, which is the book by Dr. Rajan Sankaran sir. So the main symptom of kali carb is the fear of being alone and the desire for company, right? It's belonging from the psychotic miasm. The main theme of kali carb is the vital fear and reactivity that is seen when the person lacks the support of family or a group, right? This is anxiety is seen everywhere, what we saw in our patient also. If we see kali carb in the Allen's keynote, there is a sentence given in about the kali carb, that is a great aversion to be alone, right? In Boric Materia Medica, when you read the kali carb, there is a sentence that menses early, profuse, or too late, pale and scanty, right? Which is given there. Right? So this is about the case, about the remedy selection, about the repertory chart and rubric selections of the case. Okay. So let's see some comparison between the materia medicas here now, right? As I prescribed the kali carb to this particular patient, why not the calcarea carb for this patient, right? Because the main feeling when we are talking about the calcarea carb, that is the need for the stability and security, right? In our patient, we found that there is a aggravation by the interruption in the routine. The patient is very family oriented. If anything happen in the family, if anything happen to the mother, is aggravating her a lot. She is the impact of this thing is emotionally and mentally as well as physically. She started feeling ill, which is the quality of Kali family, right? That's why the Kali and not the calcarea for this patient. If we are going to compare with the arsenic album, why we doesn't prescribe the arsenic album for this patient? So the main theme, the main crest of arsenic is that the patient sees the world as threatening. The patient feels that he is old, weak, defenseless, and there are so many thieves all around them which are ready to take advantage of the patient, advantage of the weakness of the patient. This is the main feeling of arsenic. As well, there is a restlessness also there in the arsenic. Without restless, there is no arsenic. So here we can understand differentiation of the arsenic also. In the repertorization, other remedies are also very close, which are almost covering all the rubrics. One of them, the lycopodium, is also there. So when we are talking about the lycopodium, just try to understand the gist of the remedy lycopodium. There is the main theme of lycopodium themselves become an ambition, a desire to grow big, a lot of effort which concentrate full on becoming bigger, being more powerful. Power is important for the lyco. Reaching on the high position is important for the lyco. As well, lyco is a very coward medicine. डरपोक किस्म के लोग होते हैं. Lyco is the person who can't talk or stand when they have to take in charge or they have to talk in front of so many new people. They can't talk initially few minutes, and when they start talking, they are talking like the meeting is of them only. Right? The initial talking or starting something in front of the new people is very, a dangerous task for the lycopodium. Right? So this is about some close remedies which are there in the repetization chart, where we need to differentiation between them. Right? So as I said, the prescription was Kalicarb. I prescribed the medicine Kalicarb in 1 mg potency in a single dose and put patient on the SL for next 8 weeks. Right? After the 2 months, after the 8 weeks, when the first follow-up is there on 25th 9/21, what are the improvements are there? I'm going to read from the patient's list. That is, she got menses on the 10th September 21. The bleeding was properly started. On 5th September 21, the spotting is there. On 18th September, the spotting again is there, which is stopped on 21st of September 2021. Right? She said this time she have no pain in the stomach, which is a major change for us. She is like the brownish color at the starting, and again the color is changed. The menstrual bleeding color she is explaining here. The rashes are there, the pad rashes are there, and this month was so much peaceful for her mentally. Right? Another thing, she said, I'm feeling confident now. My confidence level is better now. She's like, the overthinking thing is very less now in my mind. She feel like I should find solution inside my question only, which is a very hard for her before. She's like, I'm feeling light and peaceful. She is taking responsibility of the mother easily, and she is not feeling tense like before. Right? But instead of so many positive signs and positive effect of the Kalicarb in the patient, still the bleeding is not proper. The on-off bleeding is there, the spotting is there, the color changes is there. After 2 weeks in this follow-up, I again prescribed the 1 dose of Kalicarb 1 mg again, and again put patient on SL for the next 8 weeks. So on the second follow-up on 26/11/2021, she said that she got menses on 23rd/8/2021. The bleeding was normal. No spotting after 5th day. After 5th day, there is no spotting was there. The heaviness of breast before and during the menses is still as it is there. Right? After this follow-up also, I repeat the same medicine with the same potency and put her again on the SL for next 4 weeks now. Right? In the next follow-up, after 6 months now, this is the 6th month follow-up of the patient on 27 Jan 2022. There is no any symptom is there before, during or after menses. On 25th of January 2022, she repeated the USG abdomen, which shows the no significant abnormality in the patient. Right? So this is about the case. If you want to see the testimonial video of this case, you can go on my Facebook page or Facebook account by the name of Dr. Vibha Mevada, or in the Instagram account by the name of Dr. Vibha Mevada, where you can see the testimonial video of this patient there. Right now I'm unable to share my screen, otherwise I have planned to show the testimonial video also for this session. So I'm toward the concluding this session now. If you have any doubt, any difficulty, any query about the case or regarding the session, you can put in the chat box. Till now I'm just explaining some more things about the PCOD. So let's see the complications. What are the complications are there when the PCOD PCOS leaves untreatable or negligible for the by the patient. So the first thing is the infertility is there. Second thing, the gestational diabetes which induce the hypertension is there. The miscarriages or premature birth is there if the thing is there. The non-alcoholic steatohepatitis is there. The metabolic syndrome, the depression, anxiety, eating disorders are also there. Abnormal uterine bleeding is there. The if the PCOS, especially if we are living untreatable, 20 days, 25 days continuous bleeding I saw in the patients, right? So which is a very dangerous condition for the patient. And you in the and at the last stage complication, if we talk about the PCOD and PCOS, that is the cancer of the uterine lining, that is the endometrial cancer we can found in the patient, right? So for the treatment, the diagnosis is very important, and for the diagnosis of this condition, the pelvic examination, the visually manually inspection of organs, growth or other abnormalities are important. Instead of that, the blood test to measure the hormonal levels helps us for the diagnosis, and ultimately the main diagnosis factor is the ultrasound of the abdomen. One thing you should keep in your mind very well, that with the homeopathic treatment in some diseases, you should instruct your patient with the dietary plan, right? What things they should avoid and what things they should add in their diet is also a very contributing factor and effectful factor for treating the patient, and there is nothing wrong in that, right? So in case of PCOD and PCOS, always instruct your patient that they should avoid the sugary drinks, right? The tin packed soft drinks or juices, right? The fried food they should avoid. The processed meats like sauces, hot dogs, hamburgers and everything, they should avoid that. Other thing, they should avoid the refined carbohydrates like white bread, pasta, pastries. They should avoid all this thing. The processed food like cake, candy, sweetened yogurt, ice cream and excess amount of sugar they should avoid in when you are treating the patient actually. So what are the things which are helpful to manage this condition? So you can advise your patient to add the fatty fish in their diet, the broccoli, cauliflowers, legumes, lentils, the green leafy vegetables like spinach and other vegetables. Nuts and seeds they should take on daily basis. Berries they can take, and spices like cinnamon and turmeric can also help in this condition. So in Indian food we are definitely taking the turmeric and cinnamons in our daily routine also, right? And moderate quantity of dark chocolate can also help in this condition, right? So this is about my presentations today, and this is about my session today. So thank you so much for inviting me on this platform. I'm grateful to Allied Homeopathic Doctors Association Pakistan for inviting me and giving opportunity to share my views, my cases, and my views about the PCOS and homeopathic management, how I am managing the PCOS with homeopathy. So thank you so much. And at the end, I was just like to inform one thing here, that we are running the courses also, the homeopathic courses here. We are running 3 courses. The first one is the certificate course of classical homeopathy, which is there for 3 months. In this 3-month course, we are teaching from basic to the advanced level of homeopathic practice, where you can learn a lot or everything about clinical management and the practical things about the homeopathy. In this in this course we are you can learn the basic to advanced concept of homeopathy. You can learn the group study of 22 plus groups, which covers more than 600 remedies, polycrest rare and small remedies. Concept and detailed study of myism we are discussing in very detail about in this course. You can learn the use of mother tincture, biochemic remedies, the clinical utility of organon and repertory in this course. Other than that, how to convert the patient language into rubric, you can learn in this course. You can learn known hidden concept of case taking, how to take the case in chronic cases, in acute cases, in emergency cases, in pediatric cases, and most important, the online case taking, which is the need of this time. You can learn the different approaches to solve the cases. You can learn the acute and pathological prescription, the potency selection, the repetition of the dose, the art of follow-up, how to take the follow-up effectively, what to do when patient come with the different things in the follow-up. You can learn the use of nosot and sarcod and so many things in this course. You can learn the live case taking also, which will help you immensely a lot in your homeopathic practice, right? If you want to see the testimony video of our past batches students, you can go again on my Facebook or Instagram page and you can watch there the testimony videos of our students, right? And if you want to join us for this course, our next batch is going to start from the 28th of July 2022. So you can, for more detail, you can directly contact me on the mobile number of 9111005009, or you can write to us on mail on the mail ID of siheindia@gmail.com, right? So thank you so much for this invitation, and I'm grateful to have this time with this group of education. So thank you so much, and thank you for today.